My name is Abdulhakeem Akintobi. I'm a gynecologist and a minimal access surgeon. I'm currently the director of training of AGIS, the Association of Gynaecological Endoscopic Surgeons Nigeria. I'm happy to announce that we just concluded a 3-day intensive basic training in minimal access gynecological surgery here in Abuja. The training is the first centralized training that AGIS is conducting. Though in the past we've done some form of training, pre-workshop for our conferences, pre-congress workshops rather, for our congresses, and we've been able to organize an institution-based training at Benue State University Teaching Hospital exactly 1 year ago, which was also very impactful. Having realized the gaps in the field of minimal access surgery in the country, we took it upon ourselves to organize this training. And it was well received by our colleague. In surgery, in gynecology, we work as a team. So not only did we train doctors, we also trained our support staff, the perioperative nurses, who will be there to take care of our instruments. They circulate for us, and they ensure that safety is also maintained in the theater. So this recently concluded training, we had a total of 32 participants, 22 doctors and 10 nurses from different parts of the country. Here in Abuja, Kaduna, Asaba, Lagos, Zaria, they all came in and participated in this training workshop. And it was an interesting session. And what was the training all about? Like I mentioned earlier, this training is a basic training, so which means it's a foundation. So we try to lay the foundation for aspiring minimal access surgeon. Minimal access surgery is quite technology based, it's instrument dependent, and the learning curve is quite different when compared to conventional surgery. So any aspiring minimal access surgeon needs to actually go through this formal kind of training, and that is what we have exactly done in this program. It was a 3-day intensive training. The first day, the participants arrived very early, and by 8:15, 8:20, the program was declared open by our chief host. And we started by administering a pre-test just to get a preliminary background knowledge of our participants. And this forms a kind of a background check for us also to be able to know at the end of the training program if we have impacted knowledge into the participants. And then after the pre-test, the training proper started. We had a series of 7 lectures on day 1. So lectures started as early as 9 o'clock, and we were in the classroom till about 5 p.m. that day. Of course, in between, we had breaks for tea and lunch. And permit me to add here that this training program was not conducted by me alone. I'm just the course director that put everything together. However, I have wonderful group of facilitators, both local and international, that joined us in lecturing and imparting knowledge on our participants. And on this list is my president, the Aegis president, Dr. Adewale. We have Mr. Ola Bolarinde, who joined us from all the way from Sheffield in the United Kingdom. He was able to deliver 2 lectures, which were 1 hour long each to the participants. The lecture on ergonomics was delivered by him. Electrosurgery and electrosurgical safety lecture was also delivered by him. Joining us was also the expensive instruments and equipment. Lectures the second day. One was how to do diagnostic laparoscopy, and then the second was the role of perioperative nurses, which was taken by Ms. Olokun. And after that, we went into parallel session. So the doctors were divided into groups, and the perioperative nurses stayed in the conference room with Ms. Olokun for hands-on session on instruments, how to couple them, how to dismantle instruments, and what they need to do when they are in the OR. So the doctors were brought in here. I'm at one of the stations where we did our dry lab stations, where we did hands-on, and we had about 6 stations in this room, and participants were made to go through each of these stations, and there were several rules that we set at each station. So some stations were meant to help the participants to test their hand-eye coordination, because most of the time we work with 2D vision, so depth perception is a big problem. So we want them to have an idea how to manage and manipulate instruments through box trainer. On this particular station is we have 2 stations for hysteroscopy, and this is one of the stations for hysteroscopy. This station affords them the opportunity to know how to couple their equipment, the hysteroscope, the telescope, to the camera, and how do they navigate, the camera navigation skill they were also taught on these two stations, and they use the hysteroscope to perform some certain tasks. And so we were here for a couple of hours, and then we now took a break, had a tea break, and then we settled in the OR. So day two, in the OR, we had 4 minimum access procedure. 3 of them were diagnostic hysteroscopy, and 1 was laparoscopic, diagnostic laparoscopy, which also turned out to be operative at the end of the day, and the participants were guided on how to do hysteroscopy, as well as how to create access when they want to do laparoscopy. And all the instruments that we use in the OR, they also have first-hand, access to these instruments, and they were able to see how we do our setup, and how we troubleshoot, and how we're able to deal with issues that comes up whenever we are operating. I think we did 5 cases on day 2. There was another operative laparoscope. So we had 2 laparoscopic procedures and 3 hysteroscopic procedures. So that took us into late hours of the day, and then we closed for the day, and we resumed the following morning by 8 o'clock. And then we have another 6 procedures scheduled in the OR. This time around, we have 3 laparoscopic procedures and 3 hysteroscopic procedures. So it was a very impactful session for the participants, because we came back to the conference room for the closing ceremony, and we allowed them to also give us feedback. And from the feedback we were quite glad that they were satisfied with the level of the training, and we could see that they were also yearning for more, asking when the next training is going to take place. However, we have to encourage them that they need to go back home and put to practice what they have learned, okay? And for them to also be very mindful of safety when it comes to practice. And we are here as an association to also guide them in their practice. We have them on a blog where we can always counsel them. It's a digital age. They have access to us. We can always, through telemedicine, put them through in their various locations. I must say that the number of participants was regulated, because those who actually wanted to come for this training were far more than those that we admitted at the end of the day. And the reason was deliberate. We wanted to have an impactful session. So we had to take the number of doctors and nurses that we think we can relate with one-on-one and allow them to have maximum impactful learning. And that's why we restricted the number. So for those who were disappointed that they could not come in, there's always another time. Aegis is here, and we have started this, and we believe that as time goes on, we'll be able to do more. And for the institutions that are willing to also train their members, Aegis can bring this training to any institutions and train your local doctors and nurses, okay, using your equipment, and then, using your patient as well to help them acquire this skill. So as for me and my team, we were quite fulfill. It wasn't an easy task. Organizing a training is a difficult task, and a training of this magnitude in the healthcare sector, can be quite challenging. So it's special thanks to our hosts, Dr. Ono, the CEO of DIDA, for its magnanimity, its sponsorship, and for helping us to navigate the troubled waters. And at the end of the day, the sacrifice paid off. I must also use this opportunity to appreciate Dr. Moses Fachi, who was a very big sponsor of this program. At this stage, this program is not a revenue generating program. It's more or less like a corporate civic responsibility. We want to impact on our members, on our colleagues, and we want minimum access surgery to be firmly rooted in different parts of the country. So I think that gives the summary of this training, and we hope to see you again when next we call on you to come for our training program. And we believe that it can only get better. Thank you.